So persons with disabilities, there's barriers in general, just in everyday life, right? So whether it be transportation, whether it be access to a building, whether it be misunderstanding from community, that's just being a human with a disability in the world, right? And then there's these pieces that happen in healthcare.
We have a fair amount of evidence demonstrating that many healthcare providers and healthcare organizations are not complying with legal requirements to provide equitable care to people with disabilities.
There's lack of enforcement when it comes to disability competent care, to the ADA.
We have done numerous studies with individuals with all types of disabilities, understanding their experiences.
Lack of cultural competence in working with people with disabilities, not having the proper equipment that's needed to take care of a person with disabilities. So all of that comes, feeds directly down to people not getting the preventative care they need.
When systemic barriers live in healthcare like that, it's very concerning. We're not having a conversation about how do we enforce these pieces to, one, give providers the tools that a lot of them want. I'll be honest, there's quite a bit of providers that they have true intentions, good intentions to serve this population.
They just are not equipped and don't have the tools to do so.
That's where we have two pieces kind of just butting against each other and creating that very long-standing systemic issue.
There's no training, or very little training, in medical education for disability competency.
The work of, again, advancing equitable care for people with disabilities is really made possible by strong advocates.
It's an exciting time to make it reality, and having a course, whether that be through us or any other course, there for individuals to access information in order to be disability competent, in order to literally break the barrier and break the systemic issue.
A key part of that is addressing the biases and assumptions and lack of knowledge of our healthcare teams.
And going out to visit places like the Chanda Center to see what they're doing, talk to some of the other participants here to see what do they like, why is it that Chanda Center is so welcoming and comforting, and the person can learn how to incorporate more of that into their own practice.